compass pointing to. Dr. Nilesh Parmar is with me, London-based dentist who is raising money for charities in India. Dr. Parmar, very good morning to you. You see the scenes in India. You have friends. I don't know whether you have family there, but it's a horror story, isn't it?
Good morning. Thank you for having me on.
Pleasure.
Yes, I have a sister who lives in Bombay, and I've been seeing firsthand exactly how overwhelmed India, Bombay, Delhi have been because of COVID.
Yeah. When people come up with this sort of, I don't know, not a denial of what's going on, but a sense of we've got our own problems here to sort out first. Why should we be sending money to a comparatively wealthy country? I mean, we know about the gap between the rich and the poor is so enormous there. You know, you raise money for charities. What do you say when people say, well, hold on a second, India's got its own space program, and, comments like that?
I think it's a difficult quandary to be in. What sort of spurs me on to raising money for the charities based in India is just seeing the sheer devastation, the death, the poverty that you see. And I think COVID has made things so much more worse that almost I feel as if we didn't do anything, that would be an even greater tragedy. But one of the reasons why I wanted to fundraise, being somebody who has spent a lot of time in India, was to make sure that the money raised actually goes to the charities which are doing good work. I think as a UK taxpayer, I was born here. My concern is if the UK government does give out a lot of money in terms of foreign aid, is that money going into the hands of the people who need it? And I think perhaps more reassurance is needed for all of us.
Yeah. Well, how can you guarantee that to people who give you money?
It is difficult. Fortunately, because my sister is also a humanitarian in Bombay, we have family trust, and I know that the money that we send over goes into the hands of the people who really need it. That is one issue with sending money over to India. You want to make sure that the money goes to charities which are doing very good work on the ground.
Dr. Parmar, you're raising money. Your conscience has clearly, been moved. I mean, it is soul destroying to watch some of the scenes that are coming in from India, and then you got sort of 7 or 8 people being interviewed at one time in India, all these medical personnel sitting there, and everyone's just got their hands raised. No one's got a solution to this just at the moment. Talk to people in this country who are having a pretty hard time and are very unsure about their future and don't have too much money, and their children are in some difficulties with employment going forward. Who knows, mental health issues. Talk to those people now and say why we should be giving money to India.
Andrew, I would say in this country, if you fall ill, you phone 999, an ambulance will turn up, you'll be taken to hospital, and you'll be treated for free. The doctors will be free, the medicine will be free, and the oxygen would be available. It would be shocking if I sent a patient to hospital and they could not get oxygen. Compare that to India, where you have to pay for the ambulance, you have to pay for the medicine, you have to pay for the oxygen. And we have a situation where loved ones are having to roam the streets looking for oxygen cylinders to give to the hospital so that their parents can survive for another day. I think the contrast between the level of healthcare in this country versus what's available in India is quite shocking. And I think you mentioned it previously, there's a lot of blame which will be attributed to either the government or the politicians, etc. But that worker who lives on the street on maybe 20p a day, it's got really nothing to do with them. They're basically the victim of what's been going on. So for me, I find it, even as a healthcare professional, very important to help where we can, even if it's donating 10, 20, 50 pounds.
Much appreciate your time, and the very best of luck to you, Dr. Nilesh Parmar, London-based dentist. He's raising money for charities in India, and he's eloquently put the argument there.